Good morning, students. Today we'll be dealing with Module 1, General Anatomy. We will be talking about anatomical terminology. The learning objectives are to understand the various anatomical positions, planes and axes, to understand basic movements of the body. The anatomical position. What is anatomical position? It is that universally accepted starting point used to describe or analyze anatomical terms of movement. To be correct, anatomical position, the body must meet three criteria as it is depicted in the skeleton, which is in the picture. First, upright and standing position, face and feet pointing forward, arms at the side, palms facing forward. But how do we use the anatomical position to describe movement? That remains the question. Before looking specifically at movement, we first have to understand how to describe movement. So, by end of this session, you will be able to appreciate planes, axes, and positions. And you will be learning further the language of anatomy. The anatomical planes, see, it relates to the position in space and found at right angles to each other. These planes can be positioned on any specific part of the body. Frontal or the coronal plane, it vertically splits the body into front and back halves. Anatomically, we say into anterior and posterior halves. Next is the sagittal or the vertical, which splits the body into left and right halves. Third is the transverse, that is the horizontal, which splits the body into upper and lower halves. Then the anatomical axis. See, a lot of movement, it occurs via our joints. Axes are used to describe the direction of movement at joints. One is the anterior posterior, which is the horizontal axis as depicted in the picture. It extends from front to back. It rotates side to side. Second is the horizontal, runs from one side of the body to the other and rotate top to bottom. Third is the longitudinal or vertical, which extends superior head to inferior foot. It rotates foot. Let's apply our knowledge. See, using what you have learned today for each of these movements, cartwheel and figure skater spin, describe the motion by which plane and axis each movement occurs. See, in the first picture which is visible, it is a cartwheel kind of a movement. So in this, the plane is frontal, the axis is anterior posterior. On the contrary, when you see a figure skater spin, the plane is transverse and the axis is longitudinal. The basic movements of the human body. See, the body position terminology. The following terms will become like a second language for you. These terms are used to describe position of the body and will be used extensively when we will talk about muscles and bones. First is the superior, that is towards the top of the body. We also called it cranial. Second is the inferior, that is towards the bottom of the body. We also call it caudal. Third is the anterior, like towards the front of the body. We also call it ventral. Posterior, towards the back of the body. We also call it dorsal. Medial, towards the midline, center of the body. Lateral, away from the midline of the body. Proximal, it is situated close to the point of attachment. Distal, it is situated farthest from the point of the attachment. Superficial, which is close to the surface of the body. Deep, which is farther away from the surface of the body. Now, basic movement of the human body. The basic movement of the human body occur around and because of our joints. See, you are expected to start using these terms frequently because no longer you will say bend, now you will say flex. Rolling your ankle becomes a movement which is known as inversion. Pointing your toe would be known as plantar flexion. So what is flexion? Flexion is bending the joint to reduce the angle between the two bones. It occurs in sagittal plane. Extension is straightening a joint to increase the angle. It occurs in sagittal plane. Abduction. It is movement away from the medial plane. It occurs in the frontal plane. Adduction. Movement towards the medial plane. It occurs in frontal plane. Circumduction. It is a circular motion combining flexion, extension, abduction, and adduction. It occurs in all three planes: frontal, transverse, and sagittal. This is medial rotation. In the picture also, it is depicted moving the anterior part of a limb medially. It occurs in the transverse plane. Then is the external or lateral rotation. Moving anterior part of the limb laterally. It also occurs in the transverse plane. Pronation. It is rotation of hand. That is bringing the thumb towards midline, palm facing back. It occurs in transverse plane. Supination. Rotation of hand, bring thumb away from midline. That is palm facing forward. What is dorsiflexion? It is movement of ankle to decrease angle between the foot and the lower leg. It occurs in sagittal plane. Plantar flexion is movement of ankle to increase angle between foot and lower leg. It occurs in sagittal plane. Inversion. Middle border of foot is raised. Sole of the foot turned medially. It occurs in frontal plane. Eversion. Lateral border of foot raised. Sole of foot turned laterally. That is outward. What is protraction? Moving in a forward direction, occurs in sagittal plane. Retraction, moving in a posterior backward direction, that is occurs in sagittal plane. Opposition, thumb comes into contact with another finger. What are the learning outcomes? To apply the concept of various anatomical positions, planes, axes, and to apply the concept of basic movement of the body. Thank you.